spent the past 20 plus years supporting countless couples and individuals on the path to parenthood. She works collaboratively with mainstream medicine to provide an integrated approach to individuals and couples wishing to preserve their fertility, optimise natural conception and support their ART treatments. I first heard of Emma Cannon during her TED Talk, and it was absolutely phenomenal, so I'm extremely excited to hear her talk today. Big round of applause for Emma Cannon.
I actually still don't know how I did the TED Talk, and it will be nothing like that today, so manage your expectations, everyone. But it's really lovely to be here. This is the first time I've actually been to the conference and the first time I've really spoken to my profession, so which is exciting and slightly terrifying all at once. And such is the terrain of fertility, really. I think I was thinking about it in bed last night. Obviously, I've been preparing for months, and I was thinking about the emotional roller coaster, really, that people go through when they want to have a baby, and how, as practitioners, we really need a lot of skills to be able to hold that space for people. So I'll tell you a little bit about my background. I have been practicing, well, I started off with shiatsu actually, shiatsu and ear acupuncture, and I worked in the Gateway Clinic in Brixton for a long time. So I was really lucky because I got a lot of practice in very early on, and then I trained at London School of Acupuncture, which then became Westminster University. And I, very early on, decided that I wanted to bridge the gap between Western medicine and complementary therapies. And that actually, if Chinese medicine is to survive, sometimes we need to drop all that heavy language around it and all the mystery, if you like, and bring it more up to speed with mainstream medicine. Because as much as I'm a purist on one part, I really love all the poetic nature of Chinese medicine and the language around it. I also think it can be particularly unhelpful for people in the middle of an IVF cycle, for example. So it was a dirty job, but someone had to do it. And I really set about to build bridges with Western medicine. So I spent many years writing to doctors and not getting anything back. And I actually went to, and I recommend you to all do it if you ever get the opportunity. The Royal College of Obs and Gynaes run a week-long course called The Management of Infertile Couples. So if you do see a lot of fertility patients, if they still run that course, I think it's worth going to it. So I rock up, full of doctors and consultants and everything, and I thought, God, this is going to be intimidating. They all agree with each other, and they just don't agree with me. And then for the next week, I watched with my mouth wide open as I realised that no one agrees with anyone about anything. So then I thought, well, brilliant. There's space for little old me then in there. And I thought, where are the gaps? You know, what are the gaps? What are they? You know, they're asking patients to lose weight, but they're not actually doing anything to help them lose weight. They're asking patients to stop smoking, but they're not actually doing anything about helping them stop smoking. You know, where can I fit in to this space? And at the time, I was working for a GP in a GP practice. And are there any GPs here? So the thing that I've learned about GPs is you have to give them a very simple message. There's no point going in there and saying, I'm an acupuncturist and I can do anything, because they just won't remember you. So I thought, okay, I'm going to go in there and tell them I can do two things. They might actually be able to hold that in their head in a consultation. So I said to them, send me any fertility patients and send me, you know, any early pregnancy. That, I think I might have said anxiety as well. So I chose a very few number of things for them to focus on. And they did start sending me patients, usually ones that they could do nothing for. And some of these patients got pregnant. And it kind of grew from there, really. So I would always write. So if a patient came to see me, and I really encourage you to do this, and not to play the victim role, because I think it's very easy for us to sort of go, oh, well, you know, they're not really interested in what I have to say. And actually, even Jane Littleton, I'm not worthy, wonderful Jane Littleton, she covered my clinic once when she came over to London, and she said, what do you want me to do? And I said, if you see anyone that's with a consultant, please write to the consultant and tell them what they're doing. She was like, really? Are they interested? And I said, well, mostly not, but still do it, because it's good practice. So to this day, if someone comes to see me and they're seeing a consultant, I will write to the consultant and I will tell them what I'm doing, whether they're interested or not. And over time, a few of them became interested, because they would see that actually when somebody was going through an IVF cycle and they came in and follicles were only growing on one side, and we did a whole load of treatment to bring the follicles up on the other side, they were able to collect more eggs from the patient. Or the wonderful thing actually about working with IVF has been that you're able to see the results of your work, because we have the scans and you have feedback. So that's been really rewarding. And you know, if someone came in with an endometrium that wasn't thick enough and we were able to make a difference with that, then of course that gets fed back. So it has taken a long time of chipping away, but I really do encourage you to sort of not stay hidden in your own practice and really try and collaborate as much as possible. Can I just get a show of hands? How many of you see a large percentage of fertility patients? Okay. And does anyone only see fertility patients? Okay. So I really don't have an acupuncture clinic anymore. I have a fertility clinic. So acupuncture is just part of what I do. But I have to say that the acupuncture and the differential diagnosis has allowed me to really work collaboratively with other areas in such a different way than, say, a homeopath or a nutritionist. Because from my observation, if you go to a nutritionist, you'll get nutrition whether you need it or not. You know, if you go to a homeopath, they're pretty much going to just give you homeopathy. They're not necessarily going to put together a program of care for you. It might be an individual practitioner thing, but I think that acupuncture lends itself more to being a much more holistic type of practice, and I would encourage you to work in that way, particularly in this field. So, for example, when people come to see me now, sometimes I will send them off for a referral to someone else before they come back and have acupuncture with me, for example. So if they need to be tested, or if they need something medical doing, I will refer them off and I'll say, please come back to me, if you want to, after you've done this, but I think this is the first thing that you need to do. And so it's not being afraid to work in that way, because I think sometimes when you're in private practice, you sort of want to hold everything a bit close because you think you're never going to get any more patients. And actually what made me start practicing in this way was I actually got sick. And I thought, geez, what am I going to do with my patient list, So I began to start referring people to the nutritionist and da-la-la-la. And actually what happened is my practice really snowballed, because it kind of all came back to me in, tenfold, really. So I really encourage you to work in a collaborative way. And also, if you're working with IVF patients or fertility patients, generally, that are going through cycles, to work with other acupuncturists so that you can provide a good cover throughout the week. Because I think it is really important that they get the treatments that they need at the time that they need them. And I always say, because I work with two other acupuncturists in my clinic, I always say it's better to have the treatment when you need it than to have the treatment with me. It doesn't have to be me that does it, but it's important that you have it. And slightly controversially, or maybe not, I'd just be interested to hear your views on this, is I am very grateful for the study of the pre and post, the German study, the pre and post embryo transfer. Obviously, it's been a huge part of making my practice a success. However, I do think that we've become a little bit wedded to it. I mean, my question would be, if acupuncture can do that, then what else can acupuncture do? Whereas all the research seems to have remained steadfastly around this kind of pre and post. And of course, the reason for that is, and I'm no researcher, but the obvious reason for that is, obviously, when you're designing research, everyone has to have the treatment at the same time, otherwise it wouldn't be valid. But also it's very Western medicine reductionist, just to kind of boil it down to 2 treatments. And I always say to patients when they come sort of demanding that, is it's a little bit like putting a plant in the soil and throwing on a bit of fertilizer at the end. You know, yeah, it's helpful, but actually what I want to do is I want to cultivate the soil prior to you actually even being in that position. So completely up to you. I find that it can create quite a lot of pressure around an IVF cycle because, as you well know, this patient group can be very obsessive. And actually, sometimes I think that we're just adding another layer of stress for them. And I think we all have to be really, really mindful of that, that we don't become part of the problem, that we're part of the solution. Okay. Yeah, so the emotional roller coaster of fertility treatment. I mean, there are many. Well, what are the sort of emotional stresses you regularly see? I'll open it up to you guys. Food obsession. Yeah, food obsession.
2 weeks, 2 weeks.
The 2 weeks wait, yeah. Let me say something about food, yes?
Whether to put 2 back or 1.
Oh, yeah. I'm a 1 girl. Okay, let's talk about food obsession first of all. I feel really strongly about this actually, because I think what's happened with that is medical profession have been very, very slow to get on board with any kind of a message about food. And so what has happened is a little bit like politics, is the other end of the spectrum, the wellness world, where you can cure everything with a bit of avocado and turmeric, has been allowed to proliferate. So all of this, and I cannot tell you the amount of times that I have been asked by magazines, what are your 5 top fertile foods? I was like, if it was that easy, you know, I would be out of a job. And, you know, you can eat yourself pregnant. Well, have a go, because I've never seen it. So, you know, there's so much simplistic messaging out there around food that is really no wonder that people are confused. Obviously, we're very biased, but I actually think that the information that we can give as Chinese medicine practitioners is really generous, and it can be far less rigid. Of course, it depends on us as individuals as well, and I think there are some of us that are more rigid around diet than others. But I have to tell you, the patients that I see come under the very rigid, mostly. Now, you might see different people, and for sure, for some people, diet is really important, and they're really getting it all wrong. And of course, you can make an enormous amount of difference. But it's quite often the ones that come that think they have the best diet that have the worst relationship with food, for example. Or it's the ones that come that want a diet are the last person that needs one, really. So it's like if someone comes wanting a diet, I'm usually a bit annoying, and then it's the last thing I'll give them, because, you know, they're already really rigid on themselves. So it's like, yeah, if diet is central to the problem, then give them the diet. But if diet isn't central to the problem, actually all you're doing is creating another thing that they have to do. And they can be quite a joyless bunch of people if they've been trying for a long time, not surprisingly. But my experience generally is that by the time they've been trying for a couple of, I want to say years, but this current generation, it's months. So that's another story we'll talk about in a bit. So it really depends. The stuff around diet really depends on who's asking me the question. And I'm definitely very, very mindful about who is asking me and how much information I should give them, which I'm sure that's a familiar way of practicing for all of you. But yeah, I think steer away from the really simplistic, 5 fertile foods type thing, because I think that road leads nowhere really. There was another question about the 2-week wait, wasn't there?
And then kind of the 2-week wait between period and ovulation and am I or am I not pregnant, as well as the 2 weeks between embryo transfer.
Yeah, I often think they should be put to sleep in the 2 week, temporarily for the 2 week wait. It's like just temporarily sedated. Yeah, no, it's really difficult. But I actually do treat in the 2 week wait. What about everyone else? Everyone treat in the two. I mean, personally, and we'll go on to this because it's my most favourite bit of this whole subject, is the implantation is something that I feel that we have a lot to offer. I think we have to be really careful because the role for acupuncture is limited in fertility, slightly controversial. But we have to be very careful to use it in the right place and for the right reasons because it's not a fertility cure-all. It really isn't. And that's why it's really important to know how to use it and also to have a really good strategy. One of the biggest complaints that I get from people coming to see me who come from other acupuncturists is they didn't know what was happening. They said I'd go in every week, I'd lie down, they'd put needles in me, I had no idea what they were doing, why they were doing it, or where we were going. It is absolutely critical. And that's why I wanted to talk about management today rather than points and things like that, because I think this is something that's lacking in the medical profession as well, and I think it's lacking in our profession, is having a good strategy and having a good plan. And really checking in with your patients regularly to review that plan. So I think it's really soldier's drawing for somebody just to be coming in every week, just having acupuncture, not knowing why they're having it, and not feeling engaged in the process. You know, it's really up to us as practitioners to help engage. Because really what we're doing, as well as putting needles in people, is we're holding space and we're creating a sense of safety. So it's very important that with that sense of safety that they know where they're going and what they're doing. So typically when I sit down with someone for the first time, I'll spend over an hour with them. And part of that will be putting together the plan. So at the end of a new patient consultation, I don't know if you all do this, but I write up a plan. We've got encrypted email systems so that when we send an email with the plan, it's medical, so no one can access that apart from the patient with the code. And I strongly suggest that you move towards that because we can't be sending emails around with medical information. And if we want to be taken seriously, we have to really up our game on that front. Data is taken really seriously these days. So we have an encrypted system. And so after the initial consultation, we'll send a plan out. And if there are any letters that need to go to consultants, then we'll also send them to consultants in the same encrypted way. If anyone wants to know what it is, I don't know. I'll have to ask my PA, but I can give it to you. And actually, it's a really good way to be taken seriously by the medical profession as well. That if we're not sending courier pigeons with our with our letters of referral or whatever. So I really advise you to do that. And in that plan, I will set out a sort of short-term and a long-term plan and any kind of referrals. So I would say we're going to have acupuncture weekly for the next 6 weeks, for example, and then if you would like to have a review at the end of 6 weeks, we'll do a review. And I usually do a 45-minute review, and just to check in. Sometimes they don't need it, but I think sometimes they do, and I think they feel really held in that way. And somebody asked me the other day what it is that I felt was the most important part of the service that we provide. And I actually think it's creating safety, because I think that the fertility patients often just feel like they're failing around trying to gather all of this information, manage their own caseload. And so often they get a very poor service medically. It's slightly better than it was, but only slightly. When I first started, people would be put on Clomid without ever testing the male. They would be sent home with 6 months worth of Clomid. They hadn't even had a sperm test done. They had, it was like a mess. And so all of that goes in the first plan. Yeah, going back to that idea around Clomid and that kind of way that they treat. Sometimes I think we have to appreciate that the NHS, the system they provide, although we're very lucky to have it, it is very much relies on blood tests, and surgery and that sort of thing has become a bit old-fashioned. Whereas I personally think that surgery can be really great. But if you think about the NHS and you think about how powerful the drugs companies are, it's always been pushing for the drugs. So now, for example, people aren't offered surgery quick enough, whereas sometimes I think having a small surgery well done is better than just being put on Clomid, for instance. But if you think about how much it costs to perform surgery on the NHS, they need an anaesthetist, they need a room, they need a surgeon, and so actually quite often they're given packet Clomid, which isn't very diagnostic, as we know. So sadly, surgery has gone out of fashion, but I do work with a very good surgeon and we work very collaboratively, and it works really well, because if say, for example, somebody has minimal surgery and you support it with acupuncture, I personally think that that is often better than being on hormone treatment for months on end, really. Obviously, it's very individual. It depends on the case. But a lot of people come to me and they're like, they've suggested surgery, you know, like it's like the devil. Surgery is not the devil. Surgery can be absolutely life-saving and fantastic. And if you think about this idea, I don't know, does the idea of controlled trauma mean anything to you? Because it's basically what we do. When we do acupuncture, we're actually applying controlled trauma to the body. And part of what happens is the body's immune system rallies, you know. And actually, the same sort of thing happens when you have surgery. The body thinks it's almost can be rejuvenating. So good surgery is a good thing. So really, like, support that. Because I think as acupuncturists, sometimes we can get into this kind of negative chat with our patients about the medical, you know what I mean? It's like if it starts to go that way, because I think a lot of us have, you know, have had doubts about the medical profession at times, and obviously I work with them all the time, and I think I work with some amazing genius people who I really respect, but, you know, the same way that acupuncture is limited, Western medicine is limited as well. But I think that it's important sometimes to encourage, because I get a lot of people that say, come to me and they think, you know, all doctors are the devil, all IVF units just want their money, and, you know, and surgery is, you know, tantamount to abuse. You know, I think that we have a position of responsibility to sort of to slightly reframe some of those quite unhelpful ideas. Because actually, when I first started out working with fertility and IVF, I questioned it a lot. I just thought, what am I doing? You know, I'm having a lot of drugs, and is this going to be good for my patients? And I talked to a lot of doctors about it, and there's actually more health problems associated with never having had children than there are with IVF. 9 cycles of IVF, probably not sure, but, you know.
Can I just ask
Yeah.
about surgery?
Yeah.
Pertain to endometriosis?
Yeah, yes. Yeah, for example. But also, you know what? They used to do something called ovarian diathermy. Has anyone heard of that? So, or the charming name ovarian drilling. Yeah. I actually think it's quite a good treatment. Yes, I do. I think it can be a really good treatment, because actually what you're doing is you're going in there, and a little bit like we're doing with acupuncture, with electroacupuncture, is you're, albeit that we're not actually going in and sticking it in the ovary, but it's working in a similar way. So it's liberating the energy. If you think of it like that, it is actually, obviously there's the anaesthetic and there's all of that sort of thing. So no one's suggesting that this is always a starting point, but I think some of these things can be more useful than you might imagine. You know, if it's a choice between that and, I'm in 9 months on metformin, 6 months on Clomid, this doesn't respond. Do you know what I mean? It's like, is that better, or would you rather have just gone in and had a minimal surgery and maybe that would have worked, supported by acupuncture. Personally, I think that often that works better. And now what happens is they only use that procedure if somebody is resistant to Clomid, or so they'll always try that first, by which time you've got a more complicated problem probably anyway. Endometriosis, yes, I think really good to pair up with a surgeon who does operations of an endometriosis and treat pre and post. I think that can be a really good approach. And somebody asked about egg, one or two. I mean, I think generally we're moving towards single embryo transfer, but I think there are cases when two are useful. But I personally am a one embryo transfer myself. But.
Just the stress it causes, though, in the decision-making process. Sometimes I see it's a lot of anxiety.
Yeah, I mean, I think it's we have a role there as well. Sometimes I will talk that through with them before, because I've had cases where they're only really asked and they're texting me going, should I put one or two? And they haven't had, I used to be, but now I make sure I have a conversation around that. I mean, look, of course we have to be careful not to contradict what the embryologist, and I usually say, go with your gut, listen to the embryologist. I would err towards one generally, but it depends. There are cases for two. Yeah. Oh, great. Good.
So we guide patients based on the quality of their embryos
Yeah.
at the time. So if the patient is older, their embryos aren't doing as well, they're not at the expected stage, we would recommend two.
Absolutely.
But if they're good quality, they're young, we would go one over.
Yeah. Yeah, and that's exactly it, and that's what I would say. Always listen to the embryologist. Good job, I said that. Anyone else? Can you just show your hands now? So I don't like talking at the fertility show. There are always hidden people in there. It's awful. I'm just about launching in, and I'm like, oh, there's a person from the Lister over there. No, I mean, look, generally my approach is that we've all got to work together, and we're working, Are you an acupuncturist as well? How amazing. Welcome. Where are you, an embryologist? Fantastic. Yeah. That's really good. I think that must be a fascinating job, actually. I think of all of the jobs in fertility that I would want to be, it would be an embryologist. I think that's a great thing to be. Okay, so what else did I want to talk to you about? So all of the stresses. So let's have a little look. Okay, obsession. Obsession. Who relates to that? Obsessive patient group? Yeah, and you can see why. I think that the desire to have a child is a really deep-rooted desire. And it was really interesting. When I wrote my first book, The Baby Making Bible, what I did was I looked at what all the classics said about causes of infertility. Cold womb, jealousy. I was like, God, jealousy. And I thought, well, I can't put jealousy in a... but I kind of understood it, and I did observe it, and I very often get fertility patients expressing their jealousy, and weirdly, you never get a cancer patient saying, "I'm so jealous of that person that doesn't have cancer." It is a particular trait, and I think it comes to that sort of competitive female thing as well. I think that's all tied up in that, and also because I think it is a really deep-rooted desire to have a baby. But it's interesting, and it's interesting to know how to deal with it. So what I called it in the book is, instead of calling it jealousy, which I was like, they're going to throw the book out the window, is I put it as comparing yourself to other people. And I think that's one of the things that I see often. Is there is a lot of comparisons, and I think that obviously social media doesn't help that one bit. I think there's a lot of triggering that goes on, and it's it's interesting because I think that it can become part of the picture. I really think it can. And I think that jealousy, it creates a certain sort of a burn in the body, doesn't it? It creates a certain sort of response. And then everything is kind of filtered through that poor me, victim, trauma. And every month it's almost validated. So it becomes this cycle where it becomes very, very layered. So I think obsession, also that whole idea that we have in Chinese medicine of we all did it in our first year when we were studying, and we just thought we had everything, right? So, and I think that can go on as well, because they tend to do a lot of their own research, so they overload themselves with information, and then they can't really see the wood for the trees, and they think everything applies to them, which is, although I said that the role for acupuncture is limited, I was being a bit, facetious, but where I think we really come into our own is around this area, where we can help people. You don't want them to worry about anything, but what is relevant to them and what isn't relevant to them. And our differential diagnosis is second to none. I mean, it sets us apart from any other practice, I believe, because it gives us the ability to look at the people in front of us and create a really, really good bespoke treatment plan for them, whether that includes acupuncture or not. I mean, obviously 90% of the people that come and see me do end up with acupuncture, but you're not going to get that in any other profession. No one else is really going to do that. Whereas we really can do that, and I think it's really helpful. It's just like you don't have to worry about that aspect, but really focus on this. So we all know this, but it's good to remind ourselves, pat on the back, differential diagnosis is a very good thing. Often, I call this the one mouse theory. So we have mice in our house, and every now and then we catch a mouse, and my husband says, "I've caught the mouse!" And I'm like, "No, babe, there's never just one mouse." And it's a little bit like that with fertility, is that they find something, then they say, "Well, we found what's wrong. We know what's wrong now." It's very rarely that is the case. I mean, obviously with something like a genetic problem or a blocked tube or, something like that, then yes, of course, there are occasions when there is one cause. Generally, in my experience, it's going to be multifactorial, yeah? So, the one mouse theory, you can all use that. Painted it, but, and this kind of always looking for the answer, it creates another cycle of stress, because, of course, they'll go and ask 10 people and they'll get 10 different answers. So that's very difficult. Sex. Okay, so I have people that come and see me that are doing yoga together, they're eating a perfect diet, they're peeing on sticks, and they're having sex twice a month when the thing says so. I would literally rather them eat McDonald's and have sex every night, quite frankly, than that nonsense. And we did a survey once, and we did it over a 2-year period, and I know that some of you like to do charting and that, and I think that can be very helpful, and it can have its place. Please choose carefully who you do that with. We did a survey on people who use sticks, who use apps, who use... what do you call that? I don't know why I can't remember what you call that when you're taking your temperature. Yeah, thank you. Yeah, that thing. So we did it. We followed them over. I think we looked at quite a lot of people. It was quite a long time ago. Anyway, we found that people that use implements, all of those kind of things, have a lower pregnancy rate. They have less sex, because they believe, and they're usually the very controlling types, that they believe that they're by pinpointing sex, they're more likely to conceive, whereas actually what they're doing is they're reducing their sex life down. They're probably having really joyless sex. Let's face it, peeing on a stick and, having to have sex is not great. And I dare say something's happening with the hormones and the feral hormones and all the rest of it, and endorphins and things like that. So unless... Those apps and things can be very helpful for people who have a long cycle. And I think there are definitely, like all of these things, there are cases when they can be really, really useful. And quite often people do them the first couple of months, and it gives us a bit of information. But then quite quickly I encourage people just to have sex throughout the month and have an awareness. It's like that whole Buddhist idea, you know, like that you're holding but not too tight. So it's about having an awareness but not being totally fixated on it. Okay, so irritability and mood swings, that's something that we can really, really help people with. I think managing, helping people emotionally, helping them feel safe and their mood swings to be more stable is something that we really can help with. Falling out with family and colleagues and things like that. So I think it can be really isolating because I think that people get empathy fatigue. So I think as it goes on, people's empathy only goes so far. And I think that can be really, really difficult and really isolating, and I think that's when we can really be helpful as well. Menstrual irregularities, that's something that I think we can really, really help with. I'm sure loads of you have good experiences with regulating menstrual cycles, yeah? Amenorrhea, how's everyone doing on amenorrhea? Nightmare. Nightmare, yeah. It's quite difficult, isn't it? And particularly, I think, when there's weight loss and over-exercise involved, I think it's very difficult. I think those are probably cases where it's quite helpful to work with other people, maybe, depending on what the other issues are in it. But I see a lot of the fitness influencers. They are some of the most unhappy people I know. There is so much narcissism in fitness and so much pressure to look a certain way. And those girls with zillions of followers and not a tiny bit of body fat, they really struggle. They really, really struggle. And it is really difficult to get the periods to come back with them. And, you know, I think there's a real disconnect that goes on. And, you know, I think wellness is a really good hiding place for eating disorders and orthorexia and things like that. And going back to the statement that I made earlier, I think sometimes the people that think they have the healthiest diet have the unhealthiest relationship with food. And I would say the same about exercise. I mean, I think we are in a really good position to educate women around sort of exercise that could be more beneficial for their fertility. I've noticed in London particularly a real increase in HIIT and all of that really jerky stuff. So they come in and they are so stagnant. They have crippling periods if they have them at all. Whereas really I'm forever standing in the clinic going, now what I want you to do is I want you to get spiralling and you know, really trying to introduce into more like that sort of Kundalini movement, that whole spiraling and movement that we all know, move stagnation. But I think that's something that we can be really helpful about. And I am quite prolific on Instagram, mostly because I've published books, and sometimes I think, oh, it's such a pain, do I really want to be doing this? But actually, one of the roles that I feel that is really helpful is in influencing the influencers. So influencing these people that have many, many followers, like they're often the ones that will come up with the 5 fertile foods or the fertility smoothie. Bullshit. And you know, it's just about sort of having a communication with them and just sort of saying, actually, that's not a particularly healthy message that you're putting out, and because that's where a lot of women are getting their information now, is from Instagram, and like I say, some of the people who think they're the healthiest are really not, bless them. Okay, so amenorrhea, well, any tips welcome, because I really struggle with it as well. Mostly, I think, I've been doing some training with, does anyone know Gabor Mate? Yeah. So I'm doing some training with Gabor Mate. He wrote a book called When the Body Says No. And I'll talk to you about that book in a second. But what he is looking at is it's helping you identify hidden trauma. And I think very often in fertility, some of the people that are being diagnosed as unexplained infertility have trauma. So it could be childhood trauma, It could be obviously physical trauma, but I would say that probably in the unexplained infertility group, probably 60% have some trauma. And in the 90s, I used to sit in with this guy called Dr. Beer. Have you read the book called Is Your Body Baby Friendly? So he used to come over and he used to run a satellite clinic out of one of the IVF clinics in London. And he was really fascinating because when I sat in with him, his questioning was really like ours. And I was like, I've never heard a Western medicine practitioner, speak in this way. So he'd be saying, after the miscarriage, did you have any other symptoms? What happened? And, he'd be looking for these patterns. And I was like, I've just never seen that I've never seen that. And I'd say to him, it's really interesting because you're like a Chinese medicine practitioner and it's really close to how we practice. And he was like, that's because it's the truth. So, and of course, as he's a reproductive immunologist, so he would look at the whole system, which of course, as we know, most medics aren't looking at the whole system, they're looking at everything in isolation. So he was really fascinating. And he says something similar to Gabor Mate. And that is that sometimes what happens in the system is through trauma, or it could be through an abnormal embryo implanting, or it could be through pregnancy loss, something gets triggered in the immune system. And the way I see it is it's a bit like a dimmer switch, is it gets switched on, it never gets switched off. So it's constantly under red alert. Now, this can happen, I believe, through previous trauma as well, when people feel constantly defended in themselves. And what Gabor Mate says is, he says that the immune system and the emotional system are very similar. They run concurrently, and they're responsive systems, so they respond to stimuli. So the same way, so the emotions, as we all know, by the way, the emotions can impact on other systems in the body in a physical way. And what I found really fascinating about Gabor's work, again, it's called When the Body Says No. I really suggest you read it, At the Cost of Hidden Stress. And what he says is, at some point there was trauma in the system and then the body is defending itself. But he's looking more at autoimmune. He doesn't actually look at fertility. So he's looking more at autoimmune and cancers and things like that. But I think it's exactly the same as I've been witnessing in my patients. And also Dr. Beer talks about that. So what do we do about that? Again, I think, that goes back to the creating a sense of safety with our patients, and also getting to the root of the trauma. And in these cases, if you're not confident doing that work, and I think that we have a role to play in that, but I think often it might need some sort of talking therapy, or this compassionate inquiry training that I'm doing at the moment with him, which is designed to unearth trauma and to help. Basically what you're doing is you're holding space for the patient to witness the trauma and to work through it. So I think that's a really interesting area for fertility, and I think that in the next 10 years we will start identifying trauma as a cause for infertility. I know we all do already, but it's really interesting to look concurrently. And one of the things I like to do is look at the Western medicine work that's being done in that area, and kind of sort of saying, instead of always saying, oh, well, you say that and we say different, actually saying, we're saying the same thing, we're just using a different language, which is far more helpful for everybody, really. And I think so often that is the case. I mean, well, obviously, there is times when we're saying something completely different, but there are often times when we are saying something similar. And if you get to work with really open-minded Western medicine practitioners, actually, some of the people I work with, 90% of the time we agree. We just call it something different. And I'd much rather live in that world than just thinking all the time, well, them and us. It's not really helpful for anybody. So yeah, there's another book as well called The Body Keeps the Score. I think that's really interesting as well. So they're all sort of saying a very similar thing. And I think that in 10 years' time, or maybe even sooner, that we will attribute some of the unexplained infertility we're seeing as immune system issues. And even 20 years ago, actually, when I worked in the Gateway Clinic, there was, I can't remember, one of the professors that came over from China. He said, you know, in 15 years' time, you're going to see many, many problems with the immune system, not just underactive immune system, but overactive immune system, and a big increase in autoimmunity. And I'm definitely seeing that. So when I'm doing my question taking, I will always ask about autoimmunity in the family. So things like lupus, rheumatoid arthritis, Hashimoto's. Hashimoto's, if you have any Hashimoto's patients, definitely get them off gluten. I think it's a real trigger. And look at their gut health as well. Maybe work with a nutritionist as well. Okay, does anyone have any questions around that area?
Could you give some examples of which traumas to look for?
Well, I think any trauma, really. I mean, I think a trauma of, it can be an early trauma in life, like abuse, or it could be something much milder than that. I mean, most people have some trauma in the system, to be honest. But in terms of what we know, or what Dr. Beer would say can trigger the immune response, it's quite often when you've had an abnormal embryo implant, and then that's triggered the body to react in a certain way. So maybe that ended in miscarriage or termination, but it sort of triggers something in the immune system.
Could you relate it with the organs?
Sorry?
Could you relate that with the organs?
With the organs, it would be individual with each person. So, you know, in somebody you might have, you know, they might have a lot of suppressed anger, so of course that would be the liver, and there might be suppressed grief. Yeah, of course, I mean, we already do this, but my interest is always in finding the parallels in Western medicine. So yes, we have an understanding of this, and we treat this in Chinese medicine all the time, but it's really interesting to see when Western medics are also talking about it, and they're explaining it in their way. And that's kind of my love, and what I enjoy is just saying, like, we're saying the same thing here, you know. So yeah, it would manifest, trauma will manifest in the weakest organ system, as we know. I don't know about having an abnormal embryo implant. I mean, I think that's going to just trigger different things in different people. But yeah. Does that help?
Have you come across Roaccutane with major trauma in the system causing amenorrhea?
I mean, Roaccutane's a hateful thing, isn't it? Yeah, it's really difficult. Yeah, I mean, I've had patients that have been on it, and I think it can, cause... Yeah, I mean, it can consume the blood, doesn't it? And it really consumes the yin because it dries everything out, right? So it dries the skin out and things like that. Yeah, no, I have had people that have been on that. Okay, so I wanted to talk to you a little bit about the program that I developed to go alongside my fertility patients, and it's called 90 Days Fertile, and it's an online program that they sign up to, and they get delivered an email every day for 90 days. And it's very layered. It's got different, the beginning and the introduction, it's got sort of general introduction about fertility, male fertility, female fertility, all the kind of building blocks. And then I kind of go into these 5 pillars, which are loosely based on 5 elements. Starting with flexibility, which is part of the wood element. So in flexibility, I'm helping patients giving them the tools to move away from control, because I think control can be a really big issue. So this is about giving people tools that they can deal with the things that come up from themselves. So within each of the 5 pillars, that you will have exercises, meditations, dietary advice, even have little totem animals, essential oils, things like that. So that the main thrust of this element is how, recognizing where you're in a very controlling pattern and replacing that with flexibility. So what I decided to do is I decided to look at the 5 element system loosely, and because obviously it has some truths, deep truths in there, energetic truths, and apply it to what I was seeing in my fertility patients. So the second pillar is the pillar of creativity. And if anyone's seen my TEDx, I go through this in that. It's called About Time We Valued Being Fertile. And in creativity, I'm encouraging my patients to engage in their passions again. So what is it that you liked to do before that you don't do anymore? Did you used to paint? Other things that you used to do that you've given up? Because quite often by the time they come to me, they've given up everything in their life that gives them any joy at all. They're, peeing on sticks, having sex twice a month, and really having a pretty joyless time. So part of my job is to try and inject a bit of joy back in, and I think that we can really help people do that by actually explaining that these things actually do have a function, they do have a role, so that when we work on our creativity, we're actually working on our heart energy and we're bringing joy back into our life. It's helping us engage in things that we can see that there's joy in the world outside of just the endless pursuit of having a baby. So this is another way that Chinese medicine is really, really helpful, I think, because it's got all of this really rich resources. Nourishment, so obviously that's food, but it's not just about food, it's about where else do we get nourishment from, and how good our body is of absorbing the nutrition, and how good we are at receiving. Now, I always say that modern women are pretty bad at receiving, and a loss of fertility it's a receptive act. So the woman receives the man inside her, well, at least when I last looked it up, and the egg receives the sperm, and then the woman's body must receive the implanting embryo. So this is all very receiving. And I think this is quite a good way a good dialogue to have with women. It's like, sometimes there is help on offer for you, but you're not able to receive it. Or sometimes you're too combative, or all of these ideas that we can help patients with. So with the program, they kind of work through each pillar for a week, and it's really lovely actually, because I think they forget that it comes, and they come into clinic and they say things like, "Do you know, I've really let go of control recently. I'm so much more flexible." And I'm like, that's the program, but anyway. But it's nice that they own it, though. I mean, and they say that they've stopped going on Google, and they've stopped, they just wait for their email every day, and so metal transformation. This is about how we turn our wounds into wisdom. This is about, trying to reframe some of the trauma that people go through. I always say with my patients that instead of identifying with struggling to conceive, you're evolving to conceive. And I think that, the future fertility will be that we will have less children because we're having them later, and that's probably a good thing for the planet. And that actually the trials and tribulations that people go through in order to have their children is raising the vibration of the planet, because they will learn things like compassion and empathy and things that we need, the next generation need in spades. I mean, literally, when I first started out, my job was to explain, trying to convince women in their 40s that drinking a bottle of Chardonnay and eating a packet of Haribo's for dinner probably didn't constitute a very fertile life. And now it's like helping to wade through all of the information, all of the information that they have at their disposal, and it's just like, how do you separate the pure from the impure? It's more interesting. So yeah, turning your wounds into wisdom, and just trying to reframe some of the trauma that people go through. And then, I don't know whether I called it the right thing, really. I kind of called it belief. I wonder sometimes whether it should have been truth, but anyway. Belief sort of works. So belief is about, where are our self-limiting beliefs? So a lot of people come in and they'll say, well, I mean, I always knew I was going to struggle. It's because of that termination I had, So this goes back to the trauma, It's like, Where's the writing on our wall? Where are the things that we've told ourselves that may that may or may not be true? And so it's about helping them identify where they might have some self-limiting beliefs and working through that. But it's also about how important it is to hope and believe. I mean, there's a reason why hope is supposed to be one of the biggest sins of all. Loss of hope is supposed to be one of the biggest sins of all, because when we lose hope, we have despair. And of course, that's very draining, and that's going to be very draining on our kidney energy, which of course is not really good for fertility. And it's funny, the water type patients are the ones that want to know the truth. They're the one mouse people. They want there to be one truth, one cause, one reason, and they just want to fix it. But, and it's sort of trying to explain to them that very often there isn't just this one cause. There isn't just one mouse, even though my husband thinks there is. The other thing that I've done in clinic, which I'm going to pass these around, is that I've made these little sort of teaching boards, because I think sometimes when they sit in the front of their IVF doctor and they're just given a list of drugs, they can't really see it. And a lot of what I'm trying to do is really engage people on lots of different levels. So this is why I created all of these tools, because I feel like if they're just coming in and I'm sticking needles in them, really, how much is that doing? It's useful, but it's about what they do when they go home, and it's about how much, when they're lying there on the bed, if you're saying, I'm improving the blood flow to your ovaries, I'm working on your endometrium, it's about giving them tangible things that they can imagine so that they feel safe and that they're part of the process. And that's very, very important. And I think a lot of us go into these professions because we want to fix people, but actually you can't fix anyone, just concentrate on fixing yourself is my recommendation to that. And just give people the space and the tools to fix themselves. And if you can do that, you're really doing people a service. If you're still there as a wounded healer all the time thinking that you're going to need to fix them, and this doesn't go anywhere. We gabble mate. So I'm going to pass these around. They are very useful, and it really helps give people a visual of what's happening.
Does that kind of tie into where we give them, when we empower them and we're giving them the tools to fix themselves? That also takes a bit of the emotional pressure off of us, because it's quite a challenging area to work in, isn't it? With, like saying, the roller coaster, the highs and the lows.
Yeah.
So
Absolutely, and then I think when we start out, that's what we're always trying to fix people. And I think most people that go into this profession have some brokenness themselves that they're trying to fix, and that can play out in the consultation. So I think it's really important that we all do the self-care on ourselves, and also, at the end of a consultation, just, if it's a heavy consultation, you can say, and what are you going to do tonight for your self-care? Or what, so hand the responsibility over to them. Always say something in a consultation that implies that they're the ones in the driving seat. And that way you will never burn out as a practitioner, because you're not trying to fix something in yourself or, whatever. And that you're just holding space. And the longer that I've practiced, almost the less I say, actually. So I will ask a question and I will just open that space up. And when you ask a good question, you can see in a consultation where this kind of, it just opens everything up. Whereas sometimes if we just say, well, this is what you need to do, you just give them a solution. Well, A, that often closes things down, and B, it's usually about you wanting to give them something to fix it. And it sometimes doesn't give them an opportunity to really go into the pain. So I would often say, if it comes to a point where I've asked a question and something is opening up, I might say to them, where do you feel that in the body? What's going on for you right now? Because quite often then, they'll reveal something else that's there in the system that's coming through. And so instead of like in the old days, I would be like, well, what you need to do is this, this, and this, and here's my list of really, really good things to do. I will really try and get the patient to, I say patient, I'm sure some of you say clients, but to really engage in that themselves. And bringing it back into the body can be a really good way of them owning it. So what's going on for you right now? Where do you feel that? And they might say, oh, I've got a bit of a funny feeling in the throat. Okay, do you want to sit with that for a minute? Do you want to, And just not always rushing in to fix things for them. I think that has really been probably the biggest change in my practice over the years, is that I do less and I create more openness and more space for them to investigate themselves. Yeah, because then they leave and they actually feel like...
They're empowered, aren't they?
Yeah. It's quite interesting. A friend of mine just went and did a 10-day ayahuasca retreat in the middle of the jungle in Peru. And it was for top-level consultants, so doctors, psychiatrists. They were all hand-picked by Gabor Mate, so they were all really high-level practitioners. And on the first ceremony, the indigenous Schiphol, I think they're called. Anyway, they said, we've never had such a room of fucked up people ever. There is so much collective trauma in this group of people that we, and part of the reason is, well, there's two reasons. One is that we often, as I say, it's people who want to fix or have something in themselves that they're trying to work out. We teach what we need to learn, right? So that's one reason. The second reason is in the West, we are not taught, especially doctors. Imagine people working with trauma like in accident and emergency or drug addicts or anything like that, or with children. Like the amount of trauma that people absorb. And if you're not doing the work and if you're not doing the self-care yourself, actually how you can help people is very limited. Yeah? Really, make no mistake about it. Unless you're doing the work on yourself, the role you play in helping people is really, really limited. So yeah, the longer I've gone on, the more difficult patients that I've come across, because I think the more skills you get, then you attract a more difficult patient, and then the more work I've had to do on myself, and the less I do with patients. So I don't know if anyone's familiar with that journey, but that's certainly been my experience. Okay, so we've got half an hour. I had a few cases, really simple. I wasn't really sure how many people were going to be in the room and how it would be best to do this. But maybe if I read out, they're very simple cases. If I read them out, and it's more about the management of them, and then maybe you could just pair up or get into small groups, and then how does that sound? And then feedback, what you think. Okay, so... Oh yeah, this is a good case. So it's a professional couple, not too old. She's 32, he's 34. They both work in law. Unexplained infertility. Her results were good, AMH 21, FSH 6. His sperm count was within the normal range. She had been pregnant before and miscarried. No, she hadn't been pregnant before. They did 2 IVF cycles. With each cycle, they produced a really good number of eggs with a good percentage that fertilized. However, after day 3, all the embryos began to fall off. My embryologist will probably be able to answer this one quite well. So they've done both day 3 and day 5 transfers, but they hadn't been successful. So just have a think about that, and what you might advise, and then I'll tell you what we did do. All right? It's all right? Do I need to speak about anything else?
No, I think it would. I know you don't want to push the sale. I don't know how you feel about that. I don't know who else is in the room behind me.
Hello. It's all right. That's good.
Not as bad.
Huh? It's quite terrifying. Well, I want it to be slightly edged a bit, you know what I mean? Not just give the normal stuff. So any thoughts about this case come up? Yes.
The proof is they're stressed, they're working more. Do they have space in their lives for a baby right now?
Probably not. Yeah. No, and that's a very good point. I think creating space is really important. Yeah, that's definitely one of the things that I talk about with people. However, for me, is there any other comments on this?
We said we looked at the man more.
Yes. Yes.
DNA fragment.
All about the man. Exactly. So when the embryos fall off early on, not always, but can often indicate sperm. So in this case, I encouraged the man to go and have a DNA fragmentation test. He had a DNA fragmentation test, had high levels of DNA fragmentation, and he ended up having varicocele. So varicocele are like varicose veins. He had surgery to remove the varicoceles, which we supported with acupuncture. They did a 3 months of good nutrition, post-operative recovery, and they went on to do another IVF cycle where they were successful. So this is what I mean about how important the management of this is. Yes, it's important, the needles and what we do, but sometimes we can really play another role. And, I'm always very discreet about this kind of thing. I always sort of go, maybe go back and ask your consultant, if he would do this and, la 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 la. Does anyone know Michael McIntyre? Yeah. One thing that he taught me is he says, oh, just say, tell them to say their uncle's staying and he's a doctor and he's advised this. Instead of going and saying, my acupuncturist says, because you know what, we don't need to play the starring role, and sometimes it just aggravates them if the information comes from us. So I usually play the humble role in all of this and just say, take the road of least resistance. So, but anyway, that's what happened. They were able to pinpoint the problem. And so often that's the case. If in this case it was a one mouse, clearly, a one mouse issue. We found the mouse, we caught the mouse, and everything was happy. Okay, so and all of you know about DNA fragmentation. You all work with labs. Okay, so there's a sperm test outside of the normal sperm test. So in a normal sperm test, you look at motility, morphology. And progression, all of those types of parameters. But you can have sperm that looks completely normal, but that when they do a DNA fragmentation test, that there are the high levels of DNA fragmentation. And that can be indicated in IVF failure, or it can be indicated in miscarriage or failure to conceive. It's really difficult because patients will sometimes say to me, well, why didn't they do these tests the first time I went in? Okay, IVF clinics are not perfect, and I have no reason for defending IVF clinics, but they are between a rock and a hard place because they can't possibly advise people on the initial consultation of all of the things that could possibly be wrong. So patients will often wrongly think, oh, they just wanted my money off me, and I've done 2 cycles of IVF, and why didn't they do the DNA fragmentation test at the beginning? The reason for that is because there was no evidence at that point to suggest that it might be an issue. So I think as well, be careful not to get into those kind of conversations with patients where you're colluding with them and, try and actually preserve the relationship they have with their other healthcare providers if they are healthy relationships, and not try and be divisive. I think one of the worst things we can do as a practitioner is be divisive and, oh, just listen to me and, don't listen to them. I think the most important thing is to try and work together for, the end goal. So DNA fragmentation is something that I think that we can really well understand as Chinese medicine practitioners, because it's often to do with essence or jing or that kind of thing. And you might want to look at, does the person work with chemicals, or look at the case history. And that's something we're really, really good at, is taking a case history. And I think a lot of medicine has moved away from that. They rely very heavily on tests. I often say tests are fine, but it's like looking through one window of a house and deciding you need to renovate the whole house. based on that one room. And I think if we add our differential diagnosis to the existing diagnosis they have, we get a really good rounded picture actually, often. And it really helps to make a plan going forward. So do you want to do one more of these and then questions? Yeah.
If someone's having ICSI, would you look at DNA fragmentation?
Not necessarily. No, not necessarily. And I mean, some places are better at doing a DNA fragmentation test than others. I think it depends on their patient group. Some of the clinics in London have an older patient group, so they might think about it more readily. I think medicine can be guilty of, if they haven't got a solution for something, drug or surgery, they tend to undermine the problem or pretend there isn't a problem. So it's very much like that with autoimmunity, I think, because they don't really have a solution for it, so they sort of ignore it for quite a long time. And it's a little bit like that with the DNA fragmentation, because yes, we've got these drugs companies now that go in and they sell them Proceed and things like that. But before that, they didn't have anything to offer them. So it would be very far down their line of things that they would actually diagnose, because in the absence of having a solution, they ignore the problem sometimes.
Can I just add, if you, the proxy plus, if you're just
Yeah.
there, if you do get somebody with DNA fragmentation,
Yeah.
if they take proxy for 3 months prior to, because we've done it, we've had patients who have had high DNA fragmentation, we get them to take proxy plus, which contains an antioxidant, we then repeat the DNA fragmentation and it improves it.
Yeah.
So it is something.
Absolutely. I mean, they took Proxy Plus in this. I mean, we'll never know what made the difference, but I think a combination, you know, removing the blood stagnation, increasing the blood flow with the acupuncture, and using the Proxy Plus for the antioxidant effect.
And we would also recommend Pixie
Mm-hmm.
rather than straightforward ICSI for patients.
Thank you. Any other questions?
Obviously it varies, but how much does the DNA fragmentation?
Oh, that's a really good question. Justine? 300, yeah. Yeah. Yeah, and there's, I mean, in London we have TDL. I don't know about everywhere else, but I mean, yeah, it's quite expensive, but compared to a failed IVF cycle, you know, that's another reason why obviously they don't offer it right up front, because it's expensive and then they'd be criticised for overselling. So, did you want to do another case? Okay. So both he and she, 30 years old, fell pregnant the first time very quickly, but had a missed miscarriage, which was discovered at 11 weeks. The pregnancy had stopped at around 9 weeks. She reported having flu-like symptoms at the beginning of the pregnancy, which she thinks caused the miscarriage. However, her partner didn't have flu, no one in the work had flu. She had low thyroid function, a history of Hashimoto's, thyroid antibodies, and 2 years have passed since the initial pregnancy, and there'd been no sign of a pregnancy since, even though she got pregnant very quickly the first time. Okay, do you want to chat amongst yourself? quite weird. I'm not used to being a teacher. Any ideas? Yeah. I mean, yeah.
And get her tested for antiphospholipid antibodies.
Yeah.
Or you'll suggest that, depending on how that.
Yeah, definitely. Actually, it was quite simple in this case because we took her off gluten, we gave her acupuncture, and we worked on her gut with a nutritionist and with acupuncture. Because this is what the clue in this was that, well, there's a few clues. She fell pregnant really easily the first time, and then never fell pregnant again for 2 years. And whenever you see that, the hospitals, the doctors will nearly always say, oh yeah, but she's 2 years older now. There's been 2 years in between where she hasn't been getting pregnant. And the problem with pregnancy failure due to immune activity is what tends to happen, and I had a case last week, this woman had had one baby, she got a gestational cholestasis, so that's autoimmune. And then in the second pregnancy, after the baby was born, she got thyroid, she got low thyroid, and tested positive for thyroid antibodies, so that's tick to immune. And then she did 11 cycles of IUI after that. Both times she'd fallen pregnant, the first or second time. She wasn't seeing me for those 11 cycles. Just saying. So she's had 11 cycles of IUI, and hasn't been pregnant since. Now, of course, the clinics are saying, well, you're 2 years older now, you're 36 now, you were 34 when you had it. But what tends to happen in autoimmune patterns is that every time an embryo tries to implant and the body reacts against it, you're pushing the problem further and further. It's a bit like it's a bit like a dog. Like the more times they practice dysfunctional behaviour, the more entrenched it becomes, and immune systems are very like that. So you'll often say people will say, well, she hasn't got an immune problem because she's been pregnant twice before. It's definitely age. No, it's very typical of immune systems to present like that. And the other clue in this one, I was at one before. This idea of her having the flu coming, that symptoms of the flu. So what can happen in immune system problems is when the embryo tries to implant, the immune system begins to react against it, and so often they'll say things like, well, I got flu, that's why I had a miscarriage, or, I had an outbreak of herpes. Actually, it's not that has caused the miscarriage, it's more that the outbreak of herpes or the flu-like symptoms are symptomatic of the immune system struggling with this embryo trying to. But actually it ended up being quite simple in the end. The gluten doesn't always make a difference, but it made an enormous difference in this case.
So she wasn't on conventional treatment, like immunosuppressants. It was just
Well, that would have been the next thing, but they're in their 30s, and not everybody wants to go down that road. And I've had patients that were given immune system suppressed, their immune systems were suppressed in the middle of the bird flu outbreak, which to me seems crazy. And I've had people that go on. I'm not against those immune treatments. So for anyone who doesn't know, the way that Western medicine is beginning to treat this in some quarters, but it's highly controversial and no one agrees with it, with each other. But in the area of reproductive immunology, there are some consultants that are working around the time of transfer. They suppress the immune system in a number of ways. They either use steroids or IVIG or immunoglobulin. And not everybody wants those treatments. And that's where I think that we have a role to play, as in people who have been diagnosed with those problems. Actually, we are really well versed at dealing with the immune system and helping the immune system to adapt. And I would do a lot of work around transfer Obviously, it's highly individual, but I like a triple donor 5 and a stomach 36. And, you know, obviously it depends how it's manifesting in the person. But I think, you know, there is quite a lot that we can do to offer people without saying that we're able to treat it necessarily. But during an IVF cycle, I might see twice a week, for example, in the 2-week wait.
Do you see eczema and asthma and allergies as being part of that immune system?
Yeah, potentially, yeah, definitely. But I look more for those autoimmune problems that, you know, there's often a strong history in the family. Or, you know, it's like, well, I've got pregnant really easily and I haven't been pregnant since. 2 years later, elephant in the room, you know, what's going on there? You know, and of course they'll end up in an IVF unit and they'll be given IVF to fix a problem that isn't necessarily that. And they'll, you know, of course the IVF unit will say, well, they're not getting pregnant now. And that could potentially be because the immune system problem has just been able to progress and it's been left untreated. So I think my time's up. But if anyone's got a last question? No, she didn't. And I have a quick question for everyone. I was thinking of turning the program into something that would be useful for other acupuncturists, like an affiliate program where if they used it, they would get a percentage of the sales. So if quick show of hands, is that something that people might be interested in? Okay, so I will think about doing that. Thank you very much.